understanding mental illness, handling calls from people in distress, and getting ready to soak up the sun. This is Carolina's Healthcare System Network News. Mental illness has become a very critical issue for our time. And while most people who suffered from it do not engage in extreme behaviors like mass shootings, it still doesn't get the needed attention. Indeed, 1 in 5 Americans has a mental illness but is reluctant to seek help for it. Mental Health First Aid is a 7-year-old nationwide effort that attempts to reduce the shame and disgrace surrounding it. It's a seminar that provides participants with the knowledge to identify, understand, and respond to signs of mental illnesses.
It's an illness just like any other physical illness, but because of the stigma associated with it, people feel like they can't openly discuss it or seek care when they need it. In fact, it's almost 10 years after the onset of a mental illness that people actually seek help. Sometimes it's too late.
Everyone has a role in helping. By listening, engaging them, helping them to assess the right materials or resources to assist them, and just being there for any of the people that we may come across.
The more we educate ourselves, the more we know, the more guidance or the more support we provide people that need our help.
We have someone that just 2 weeks ago attended a class in Cabarrus County, and it was offered through one of our faith communities. When this woman got home, she had a friend that called her and said, "I am considering taking my life. In fact, I've just taken some pills." This class participant, prior to taking Mental Health First Aid, would have been so scared she wouldn't have known how to handle that situation. But because she had just taken this class, she knew how to go to her friend, sit by her side, talk her through this, help her to stop that negative activity, and help her to get to the appropriate care. A life was saved because of someone participating in Mental Health First Aid. That's our goal.
Carolina's healthcare system has taken on the challenge of addressing the mental health issue by setting up a behavioral health call center.
Do you have any family or friends that can support you at this time while you're going through this difficult time?
As call centers go, this one looks pretty typical. Operators sitting in cubicles with headphones, fielding calls from customers, taking notes, looking at computer screens, troubleshooting problems. But this call center is staffed by operators who are trained mental health clinicians.
The people that are answering the phone for individuals calling in that are seeking help or are in crisis are our licensed professionals and licensed clinicians. Our call center fields approximately 15,000 calls per month from individuals that are seeking assistance with mental health or substance abuse services. We will spend as much time as we need so that the person returns to some emotional equilibrium.
Alicia Rogers is a mental health clinician. She's on the front line of receiving calls from those in serious distress.
With the patients that call, we're normally getting parents who's wanting to initiate services for their children, as well as adults who want to initiate services for themselves. Again, we do have crisis calls with people who feel that they're reaching too many barriers to services, so they're feeling distressed, as well as individuals who are feeling that they're at a really low in their life at this time and wanting to have thoughts of committing suicide or wanting to harm themselves or others. I'm very passionate about the work that I do, and I think that's one main reason I chose the field is power in words. And I believe that they can feel my passion and my compassion towards the work that I do via the telephone.
We listen. We are able to help people that are in distress because we listen. It's very simple. When they call us, we are providing them with a kind, compassionate voice, and we're asking them what they need. At the time, they may not know, and our goal is to help them get there.
Attention all you sunbathers out there. Do you really know how much sunscreen to use? You need to use at least 1 ounce or enough to fill a shot glass. And here are some other tips that'll keep you safe as you take in those rays. Regardless of the SPF number, all sunscreens should be applied every 2 hours or after sweating or swimming. Just because you use a high SPF doesn't mean you can spend more time in the sun without burning. And most importantly, it should be applied 15 minutes before going out because it takes that long for your skin to absorb it. In addition to sunscreen, you really should protect yourself by seeking shade, wearing protective clothing like long-sleeve shirts, pants, a wide-brim hat, and sunglasses. And what applies to you also applies to the kids, especially babies. For babies up to 6 months, it's okay to use sunscreen, but do a test patch to make sure it doesn't irritate their sensitive skin. For babies 6 to 12 months and for older kids, slather on the sunscreen 15 minutes before heading out and reapply every 2 hours or after sweating or swimming. Okay, now you and the family are ready to take in the great outdoors.